In 1998, a research paper published in the esteemed medical journal sent shockwaves through the medical community and the public alike. The study, led by Dr. Andrew Wakefield, claimed to have found a link between the MMR vaccine, which protects against measles, mumps and rubella, and the development of autism in children. This sparked widespread fear and ignited a wave of vaccine hesitancy that continues to this day. The study's methodology was soon heavily criticized, and after numerous large-scale studies found no such link, retracted the paper in 2010. Wakefield was stripped of his medical license for ethical violations and professional misconduct. However, the damage was done. The seeds of doubt had been sown, and despite the overwhelming scientific consensus on the safety and efficacy of vaccines, the Wakefield study's legacy continues to cast a long shadow. The anti-vaccine movement gained momentum, fueled by misinformation and fear-mongering, often disseminated through the internet and social media. This legacy of distrust has had a tangible impact on public health. Vaccination rates have declined in many parts of the world, leading to outbreaks of preventable diseases like measles, whooping cough, and mumps. The internet, while a powerful tool for information sharing, has also become a breeding ground for misinformation, especially regarding vaccines. False claims, often presented as scientific evidence, spread rapidly through social media, online forums, and even personal blogs. This creates an environment where it can be difficult to distinguish fact from fiction. One of the most insidious aspects of online misinformation is its ability to confirm existing biases. People tend to seek out information that aligns with their worldview, and social media algorithms often reinforce these echo chambers. This can lead individuals down a rabbit hole of misinformation, solidifying their beliefs even in the face of overwhelming scientific evidence to the contrary. The emotional nature of the issue further complicates matters. Parents naturally concerned about their children's well-being may be more susceptible to fear-mongering tactics used by anti-vaccine proponents. The desire to protect their children can override rational thought, leading to decisions based on emotion rather than evidence. Adding to the challenge is the sheer volume of information available online. It can be overwhelming for individuals without a scientific background to sift through the noise and identify credible sources. The anti-vaccine movement thrives on misinformation, often peddling unfounded claims that have been repeatedly debunked by the scientific community. These claims can spread quickly, especially through social media, creating a false sense of fear and uncertainty about vaccines. It is crucial to address these myths head-on and provide evidence-based information to counter their harmful narratives. By doing so, we can help people make informed decisions about their health and the health of their communities. One persistent myth is that vaccines cause autism. This myth has caused significant concern among parents, leading some to avoid vaccinating their children. This claim stems from the discredited Wakefield study and has been thoroughly debunked by numerous large-scale studies involving millions of children. These studies have consistently shown no link between vaccines and autism, reinforcing the safety of vaccines. The scientific consensus is clear: there is no link between vaccines and autism. Leading health organizations around the world, including the World Health Organization and the Centers for Disease Control and Prevention, support this conclusion. Another common misconception is that vaccines contain dangerous ingredients, such as mercury or formaldehyde. These ingredients are often highlighted by anti-vaccine proponents to instill fear. While it is true that some vaccines contain trace amounts of these substances, the levels are far below what would be considered harmful. Regulatory agencies ensure that vaccines are safe and that any ingredients used are within safe limits. It is important to note that these substances are often found in our environment and food in higher concentrations. For example, mercury can be found in certain types of fish, and formaldehyde is present in many household products. Some also believe that natural immunity is superior to vaccine-induced immunity. This belief can lead to dangerous practices such as intentionally exposing oneself or one's children to diseases. While natural infection can confer immunity, it comes with the risk of serious complications from the disease itself. Diseases like measles, mumps, and whooping cough can cause severe health issues, including hospitalization and even death. Vaccines, on the other hand, provide a safe and effective way to build immunity without the risk of contracting the disease. They are designed to stimulate the immune system in a controlled way, providing protection without causing illness. These are just a few examples of the many myths circulating about vaccines. Other myths include the idea that vaccines are part of a government conspiracy, or that they are unnecessary because certain diseases are no longer common. It is imperative to approach such claims with a critical eye and rely on reputable sources for accurate information. Trusted sources include healthcare professionals, scientific journals, and public health organizations. By staying informed and skeptical of unfounded claims, we can protect ourselves and our communities from the dangers of misinformation. The science of safety: understanding vaccine development and testing. Vaccines are one of the most rigorously tested medical interventions in the world. The journey from a concept to a fully approved vaccine is a meticulous and highly regulated process. The development and approval process is lengthy and involves multiple phases to ensure both safety and efficacy. Each phase is designed to answer specific questions about the vaccine's performance and safety profile. Before a vaccine is ever administered to humans, it undergoes extensive laboratory and animal testing. This initial phase is crucial for understanding the basic properties of the vaccine candidate. This preclinical phase aims to determine the safety of the vaccine candidate and identify potential side effects. Researchers study how the vaccine interacts with the immune system and whether it produces the desired immune response. If the vaccine passes preclinical testing, it moves on to clinical trials involving human subjects. These trials are essential for understanding how the vaccine works in people and are conducted in a highly controlled and monitored environment. These trials are conducted in 3 phases, with each phase involving a larger number of participants. This stepwise approach helps to ensure that any potential issues are identified early and addressed before the vaccine is widely distributed. Phase 1. Trials assess the safety of the vaccine in a small group of people. This phase focuses on determining the appropriate dosage and identifying any immediate side effects. Phase 2 trials evaluate the vaccine's efficacy in a larger group and determine the optimal dosage. Researchers also gather more data on the vaccine's safety and its ability to generate an immune response. Phase 3 trials involving thousands of participants confirm the vaccine's effectiveness, monitor side effects, and compare it to existing treatments or a placebo. This phase is critical for understanding how the vaccine performs in a diverse population. Only after a vaccine has successfully passed all 3 phases of clinical trials and has been rigorously reviewed by regulatory agencies like the Food and Drug Administration in the United States or the European Medicines Agency in Europe is it approved for public use. These agencies meticulously review all the data to ensure the vaccine meets the highest standards of safety and efficacy. Even after a vaccine is approved, it continues to be monitored for long-term effects through post-market surveillance programs. This ongoing monitoring is essential for ensuring the continued safety of the vaccine as it is administered to the general population. This ensures that any rare side effects that may not have been detected in clinical trials are identified and addressed promptly. Post-market surveillance helps to maintain public trust in vaccines and ensures that they remain a safe and effective tool in preventing disease. Herd immunity, a collective shield against preventable diseases. Vaccination not only protects the individual who receives the vaccine, but also contributes to a broader public health benefit known as herd immunity. This is a crucial concept in the fight against infectious diseases. Herd immunity refers to the indirect protection from infectious diseases that occurs when a significant portion of a population is immune to a disease, either through vaccination or previous infection. This collective immunity helps to slow down or even stop the spread of diseases within the community. When a high percentage of the population is immune, it becomes difficult for a disease to spread from person to person. This is because the disease has fewer opportunities to find a susceptible host. This is because there are fewer susceptible individuals for the disease to infect. The chain of infection is broken, and the disease can no longer propagate as easily. As a result, even those who are unable to get vaccinated, such as infants, pregnant women, or individuals with compromised immune systems, are protected. This is especially important for those who rely on the immunity of others to stay safe. The threshold for herd immunity varies depending on the disease and the vaccine's effectiveness. For some diseases, a lower percentage of immune individuals is sufficient, while for others, a higher percentage is necessary. For highly contagious diseases like measles, herd immunity requires vaccination rates of around 95%. This high threshold is due to the ease with which measles can spread from person to person. If vaccination rates drop below this threshold, outbreaks can occur, as seen in recent years in communities with low vaccination rates. These outbreaks serve as a stark reminder of the importance of maintaining high vaccination coverage. Herd immunity is a powerful example of how individual actions can have a profound impact on public health. By getting vaccinated, each person contributes to the overall health and safety of their community. By choosing to vaccinate, we are not only protecting ourselves, but also contributing to the well-being of our communities, especially the most vulnerable among us. This collective effort is essential in preventing the spread of preventable diseases and ensuring a healthier future for everyone. Education and awareness about the benefits of vaccination are key to achieving and maintaining herd immunity. Community health programs play a vital role in spreading this knowledge and encouraging vaccination. Healthcare workers are on the front lines, tirelessly working to administer vaccines and educate the public. Their efforts are crucial in the fight against preventable diseases. Together, through vaccination and community effort, we can build a collective shield against preventable diseases, ensuring a healthier and safer world for future generations.